I'm Dr. Louise Newson. I'm a GP and menopause specialist, and today I'm going to talk about the menopause and how it affects women, and also, very importantly, how it might affect women in the workplace. So I'm going to talk about how the menopause can affect women in the workplace, its potential impact on work, and also ways of how women can receive optimal help and treatment, not just in the workplace, but for themselves personally. So looking back at the history of the menopause is really important because a lot of people think the menopause is just a transient episode in a woman's life. And of course the menopause is a natural process, but it's important to think about it because in the 1900s, in the Victorian times, the average life expectancy was a lot less than it is now. Women tended to go through the menopause in their late 50s and they'd die quite soon after. And you could actually argue that we are designed to reproduce and then expire. Thankfully, it's not like that now. So the average life expectancy of women now is 82, so decades older. But this means that women are living for decades, sometimes a third of their lives, without hormones, because the menopause occurs when our ovaries stop producing eggs, either naturally or enforced, for example, by an operation to remove a woman's ovaries, and so there are no hormones that are replaced by the ovaries. So this means that women have their menopause, whether they have symptoms or not, because it's a long-term hormone deficiency. So around a third of a woman's life potentially is in their menopause. It's a long period of time to live and survive without receiving optimal help and treatment. So it's really important, I think, to recoin the phrase. Rather than menopause, think about it as a long-term female hormone deficiency. So the menopause can cause lots of symptoms due to these low hormone levels, and I did quite a lot of work with West Midlands Police, and this was a pictogram that was put onto the back of all toilet doors. You can see the symptoms range from the vasomotor symptoms, which most people know about, so the hot flushes and sweats, but also symptoms such as low mood, anxiety, memory problems, fatigue, reduced motivation, joint pains, muscle aches, headaches, migraines, reduced libido. So you can see that a lot of women, all these symptoms can really affect them in their day-to-day personal life, but also their ability to function in the workplace. When we put these on the back of toilet doors, one police officer said to me, "Do you know what? I love the pictures, but I hate going to the toilet. I feel really sad because I am that woman. I have all these symptoms, yet I don't know how to get help, and I've been struggling for a few years, and this really needs to change." So there are different ways of managing the menopause. Talking about it, listening about it is really important because a lot of people think it's just causing some hot flushes. Women will get through the other side and they'll be fine because it's a natural process. But actually it can cause all these symptoms, and women are misdiagnosed all the time with things such as depression or fibromyalgia, chronic fatigue, and actually it's all related to their hormone levels. So education is really key. A lot of women, this is a survey we did in West Midlands Police that showed that 77% of women didn't actually realise their symptoms were due to the menopause until they were given information about the menopause. And nearly half of women have been found not even to see their GP, and that's because they think they shouldn't make a fuss because it's a natural process. So it's important that we break the taboo and start talking about it, because actually anyone who knows a woman or loves a woman should know about the menopause. So it's not just a female problem. It affects all women, so 51% of the population globally, but it indirectly affects men too. The stigma needs to be reduced. We need to be more open talking about it. And it's not just the personal effect on women's lives. Think about the financial costs of the menopause. So I've just listed some diseases that increase during the menopause due to the low hormone levels. So depression increases, cardiovascular disease increases, so does osteoporosis with hip fractures. 1 in 3 women will develop an osteoporotic hip fracture. The risk of type 2 diabetes increases during the menopause, and also osteoarthritis. dementia is very common, and it's far more common in women because of the low hormone levels that occur. And migraines can worsen as well. So I've just listed here in the UK the staggering costs for these conditions. So if you take mental health, £94 billion a year, cardiovascular disease, £19 billion a year. Hip fractures cost the NHS £2 billion a year. Not all of these obviously is related to the menopause, but a significant proportion are. So if menopause care is optimally managed, you can already see that there's big savings for the NHS as well as to organisations. So we know also that women taking HRT have a reduced risk of all these conditions, so therefore are less likely to get these diseases and less likely to spend money related to these diseases in healthcare costs. If you think about the Equality Act of 2020, there's been a bit of muttering in the media about, does the menopause amount to a disability? And there's been a bit of a kickback to women saying, of course not, how could it be? It's a natural process, of course it's not a disability. But let's think about what a disability means. A person has a disability if she has a physical or mental impairment, and this impairment has a substantial and long-term adverse effect on her ability to carry out normal day-to-day activities. Now, every day in my clinic, I speak to women who have given up their jobs because they cannot function. A barrister said to me the other day, the shutters have come down, I can no longer think, I'm not safe to work. I see other ladies who are secretaries, who are PAs to people, and they say, I look at the screen and I do not know what to do. I can almost hear sniggering in the background of younger assistants who know what they're doing. I've done this job for 30 years, but I can't do it anymore. And another lady said to me, in fact, yesterday, women need to know that the menopause means that they have to adjust their work. They have to have lower pay and they have to have a different job, often part-time. And of course they don't have to, but they need to understand that the menopause can really affect people physically and mentally. So the definition of a disability sounds quite harsh, but it's something that employers need to think about and really wake up to the fact how many women are suffering. So no one wants to be discriminated against, and least of all menopausal women. And none of us who are menopausal women want to wear a badge saying that we're menopausal. We don't want to be treated differently, but we want to be able to receive the right support, help and treatment, so then we can function at work. We don't have to reduce our hours, we don't have to have flexible working, and we certainly don't want to be considered that we have a disability. So people talk about potential reasonable adjustments to the workplace, things about changing start times, providing regular breaks, adjustments to the absence management procedure, and the adjustments to performance management procedures as well, and even reducing hours at work. A lot of women don't actually want these, and the reason that they're having them is because of their menopausal symptoms. And for me as a healthcare physician, it's really important that women receive the right help and treatment. Flexible working as well is something that people often go to, but not because they want to. A lot of these women are going home and they're going to sleep in the afternoon, or they're just staring at the four walls. They're not actually enjoying their change in working pattern. So when we think about menopausal symptoms at work, everyone talks about the hot flushes, they think about changing the air conditioning, changing the temperature, changing uniform, and obviously this can be important for a lot of women. But actually some research we did in West Midlands Police said that the symptoms most likely to affect people in the workplace were not the vasomotor symptoms, they were fatigue, memory problems, and poor concentration. So these can't be addressed by changing a temperature of a room. There's far more that needs to be done to help these women. We know that retirement age is increasing. We're all encouraged to work longer, which is great if we enjoy our jobs, and a lot of us have worked very hard to get to where we have. And the last thing we want to do is to retire early because of the menopause. Studies or the figures show that around 3.5 million women aged between 50 and 65 in the UK are currently in employment. And the Department of Work and Pensions have found that working beyond the state pension age has contributed to £13 billion to the UK economy. They were figures from 2013, so I'm sure it's even higher now. So that's a huge amount of money that would be lost if these women gave up work. We know that having menopausal symptoms can lead to less engagement with jobs, less job satisfaction, and actually women are more likely to quit their job because of their symptoms. And as an employer, you don't want to be employing people who are more likely to give up their job. And as an employee, you don't want to be thinking about giving up your job. So menopause is often a silent issue. People don't talk about it, and it needs to be brought forward in the way that mental health has been brought forward onto the agenda over the last decade or so. We undertook a survey in West Midlands Police, and we found that 10%, so 1 in 10 women, had stopped work altogether because of their menopausal symptoms. We've done some more research more recently and showed that 20% of women had admitted to giving up their work because of their menopause. This is a staggering amount of women that are leaving their workplace. Also on this study, we found that 87%, so the vast majority of women, had said that they thought their supervisor or line manager really would benefit from some menopause training. And that's no surprise. Men, women, children, adults often don't know enough about the menopause. They just think it's a time when periods stop. And of course it is, but it's far more than that. We also found that nearly 25% of women in the police force had had time off work as a direct cause of their menopause. A lot of these women, though, have been signed off with symptoms such as depression or anxiety, and this often is written on the sick note, and then they're labelled as having depression when they haven't. It's related to their low hormone levels. So this questionnaire that we undertook recently, we asked women, have your menopausal symptoms ever had a negative impact on your work? And 94% of people questioned did. This was another questionnaire looking at what the reason for their time off work had been documented on their sickness. And you can see here that 52% was anxiety and stress, and only 7% was menopause. Now, as a menopause specialist, I have often written menopause as a cause for a woman's time off work for her to have on her sick note. But a lot of people don't do that. And this is really sad, I think, for women, but it's also misleading for employers as well. The British Medical Association, the BMA, recently undertook a survey of GPs looking at the impact of menopause in the workplace. And they produced it, and it's called Challenging the Culture on Menopause for Working Doctors. They had 2,000 responses, so it was a good study, but the results were really sad. 93% had experienced symptoms as a result of the menopause. 65% of the people who answered had both physical and mental, so psychological symptoms. 90%, again the vast majority, had said that these symptoms had impacted their working lives, and a third of them, the impact was significant. Over a third, so 36%, said making changes to their working lives had to have occurred as a result of their menopause. And 38% had wanted to make changes, but they weren't able to. And only 16%, a vast minority, had discussed their menopause symptoms with their manager, and nearly half had wanted to, but they didn't feel comfortable to doing so. So these are GPs, these are medical practitioners. These are people that should have training on the menopause, yet they're not getting help. So what does that mean for other people in other organisations? I really dread to think. So there are some guidelines about menopause in the workplace. These were produced from the Faculty of Occupational Medicine in 2016. And some people use them. They're very simple. They're very easy to download and read. You might say, what's the point of employers helping? Why should we bother? Well, actually, it's really important because we know that if there is a positive action by employers, then it can actually really help women. It can contribute to engagement by the employee, and we can improve productivity, which can enable job retention. So many women are neglected, and as an employer we should really have a responsibility to make sure that no women are neglected. We need to think about inclusion and diversity, and we need to acknowledge that all women go through the menopause regardless of their background, and actually a lot of young women go through it as well. So 1 in 100 women under the age of 40 have an early menopause. So it's not something we just need to think about for our workforce who are in their 50s or 60s. We need to think of younger women as well. So as employers, how can we help women? There's a lot we can do to help, and it's not just helping women actually, it's helping men recognise in other women, and it might be other women working in the workforce, but it might be women at home that need recognising, and actually a lot of men who live with menopausal women find that their jobs improve when their menopausal women get the right help and treatment also. So we need to increase the awareness and reduce taboo. We need to be responsible clearly for the health and safety of all our employees working with us. There should be some baseline training for managers and employees, and just listening to this presentation is the first step in that process. We need to think really hard about the disability question that I posed earlier for women who have severe symptoms. It's important to network with other organisations. The menopause has been spoken about more, which is really good, but we need to take it to the next level. We really need to be giving women the right treatment and help. Women need to have access to menopause clinics, and I think this should be done as part of their standard staff benefits. There is inadequate funding for good quality menopause care in the NHS, and this urgently needs to change. But in the meantime, employers that help their employees have access to private healthcare, they should really look at having access to private menopause clinics, which could be partly funded by the employees, because these women are usually desperate to get help. They're desperate for treatment, and they're actually desperate to go back to work. So there can be some really good partnerships with employees to access menopause clinics, because that's the only way often a lot of women will be able to receive the right treatment. It's not just about employers, it's about women too, of course. They have to take some responsibility for their own health and their own future once they have the right information. So they really need to increase their knowledge about the menopause, and it needs to be evidence-based. There's a lot of information out there which isn't evidence-based, so we need to make sure that the sources are accurate. It's important discussing their practical needs. Some women may find that changing their uniform makes a difference. Some women tell me they have to have 8-10 showers in the morning because they get so hot and sweaty and would prefer to start working a bit later. So this might be an option for them. So it's important that any help is potentially individualised. Occupational health have a really important role to help with supporting these women. We need to think about ways that will help with their mental health, which I'm sure a lot of employers are doing already, but look at ways with relaxation, mindfulness, also CBT, cognitive behavioural therapy, can be very useful, certainly in the menopause. Lifestyle is important, and actually if we all look at our lifestyle, if we can eat healthily, we can exercise regularly, we can relax, we can sleep well, that's going to improve our mental state whether we're menopausal or not, and make a big difference to the way we work. So the main treatment for the menopause is replacing these hormones. I've already said the menopause is a long-term hormone deficiency. So if you have a deficiency of something, doesn't it make sense to replace and improve that deficiency? Of course it does. So we replace with hormones HRT. Now HRT is very safe, it's very effective, and it's also very cost effective too. So currently, sadly, only around 10 to 15% of women are given HRT, whereas we know from the evidence that HRT provides more benefits than risks to the majority of women. Giving HRT actually replaces the hormones, so it improves symptoms, but it also improves future life, so it reduces future risk of diseases such as heart disease, diabetes, osteoporosis and dementia. So women should have access to adequate information about HRT and also treatment, and that treatment should be given by a healthcare professional. Sadly, around 70% of perimenopausal and menopausal women are offered or given antidepressants, which is not a treatment for the menopause and shouldn't be given for the low mood associated with the menopause. This slide shows a questionnaire that I did recently, looking at how people experienced their getting help for their menopause and what their results and outcome was. And you can see on the right, the big bar shows that they actually were very disappointed with the level of care they had received. And this is really a reflection of how poor menopause education is for healthcare professionals. We know that a lot of GPs, nurses, pharmacists don't have menopause training. And for me as a menopause specialist, I find this really shocking. The menopause affects all women. So any healthcare professional who's seeing a woman has to know about the menopause, and I'm hoping this is going to change. So we also asked in this questionnaire who'd been offered HRT, and 40%, which is actually higher than I would have expected, had, but 60% hadn't even been offered it in a consultation when a woman had gone knowing she was menopausal. There are a lot of women who go and see their GP and don't even realise they're menopausal. So it's very important, if anyone's listening here who thinks they're menopausal, be armed with the right information, and then you can help direct the consultation to receive the outcome that you want. So there's lots of ways of women receiving accurate information. I've produced a book, the Haynes Menopause Manual. There's plenty of booklets and information that people can access. So my website, menopausedoctor.co.uk, has plenty of free evidence-based information that's easy to download by women, also by men, and also by employers as well. I'm not sponsored by anyone, I don't endorse any products, so all this information is non-biased, and a lot of people find it very helpful to use or to share. I've also created a free app called Balance, which can be downloaded, and people can monitor their symptoms, they can monitor their periods as well, but they can also track how their symptoms improve with various treatments. And there's a community section so they can share their experience and others can comment on that. So that's something that a lot of women are really finding useful, and that might be something that you might want to encourage your employees to download and use. So who can help women? So I put on this slide, friends and family are really important. People should be encouraged to talk about how they feel. GPs, practice nurses can be very useful points of contact in the healthcare system. The occupational health team at work certainly have a role, and menopause clinics, but sadly there aren't enough of them, but we should be encouraging more to open to really access and help more women. So finally, just a few take-home messages for you. I hope now you've realised the menopause is more than just some symptoms. And low hormone levels can't be replaced, however good your lifestyle is, without taking HRT. And HRT is safe for most women. There's very few women who really can't take HRT. So if anyone is struggling, even if they think they've got a contraindication for HRT, they need to see a doctor who specialises in the menopause for some key individualised advice. We know taking HRT provides more benefits than risks for the majority of women, and women deserve and should receive individualised advice. But above all, education is key. It's essential that all women and men receive education about the menopause, because it's going to affect all women. So even if they're young women, they need to know and be prepared, and it will indirectly affect men. So having the conversation early, being transparent, being open can make a huge difference. Thank you.